we've got some exciting news that we've been building up all week for you. Basically, you all know, or many of you know, that in 2019 I became a Fear-Free certified practitioner. And earlier this year, my staff here worked hard and joined me in getting their own certifications. Yay! But we also took another step further, and together as a team, we worked hard and we actually got our practice certified. We are the first Camden County within 80 miles of other Fear-Free clinics to be a certified practice. And so I wanted to bring everybody on and share that great news, and you guys all did great hard work. So you will continue to see some changes here as we continue to practice our Fear-Free technique. And so many of you may be asking, what is Fear-Free? Or many of you who have visited us, you've seen what we've done and how we do it. And of course, you can probably share some success stories and some stories that we need to make it a success story. But I wanted to ask these guys a couple of questions because I know this has been a long journey for me. And this has been a journey that they've been working on since February, March time period. So it's been several months that we just want to share this with you. So my first question, because again, everything always starts at home or on the phone call. So Harley here is our client care representative, and hi Harley. A lot of times, you know, you do get clients that call you and they tell you about how, I guess sometimes they say that they're antsy or anxious and that they don't want to come to the vets. And clients don't want to come to the vets either, but that their pets, they're afraid to bring their pets to the vets. And a lot of times too, we find out that people have cats that they don't bring to the vets because cats, that's a whole other topic. But that's something that we'll talk about later. But how have you dealt with clients and kind of encompassed that Fear-Free and talking with them?
Yeah, so gearing up, you know, for our appointments, we like to send out, you know, as much information as we possibly can. But not only getting to know the FAS or fear, anxiety, stress levels of our patients, but getting to know our clients, you know, emotionally, you know, physically, why are they stressed out? So reverting our attention to the client and supporting them in travel with their patient from the home to the office, getting them all the tools that they need, all the information that we can possibly get to them is one of the first steps that I like to make sure that we have all of that in hand for the client to be successful. But not only talking about their patient, but talking about why the client's experience from, say, either the previous visit or their previous clinic, we can possibly, you know, make this a success story versus, you know, maybe having a happy visit or two, you know, and making sure that they're comfortable with, you know, the first phone call that they have. So focusing on all the information, but getting to know them on a personal and emotional level too, and showing them why we are Fear-Free. Like, I started as a client here, and being able to actually enjoy being a client here and showing them why I chose to apply for your office was, you know, the foundation of becoming Fear-Free for me, because that is the embodiment of why I want to be here and, you know, support our clients.
Yeah, and we're glad that you came here from the client side. And again, some of you guys are trying to wonder, like, what is Fear-Free? I know you guys always ask me, what is Fear-Free? Why I became Fear-Free? And even on the human side, I'm not a human vet or human doctor. I don't like a lot of stress plays a role in your health and on your body. And we only have one life, we only have one body. And same with our pets. I know my pets growing up were outside pets, and as I aged, they became my children. And a lot of us have that. Some people who can't have kids, the furry pets are their kids, which is, you know, which is amazing. But so we are trying to get everybody to realize, and it's something that I take dear to heart, of what that stress and anxiety does to their body and their healing. And that was a big driving force for me to want to make this Fear-Free successful, for not just for me as a practitioner, but for everybody here. So
They feel our feelings. I mean, they're our fur babies, you know, they feel our emotions, and when they're coming in office and, you know, the client has those emotions, it's going to be the same for the pet. So we want to establish a fear-free motivators for both of them, you know, and make sure that they're both comfortable.
Yeah, because when we see our pets happy, that makes us happy.
Yeah,
So it just helps.
And when you're sad, your pet sometimes will start to play off your cues, and
Exactly,
either
yeah.
they'll, if it's a dog, they'll try to make you happy because they know you're sad.
Exactly.
If it's a cat, they're just gonna be like, screw you, I'm out of here, you know? That's cat's world. But, so thank you, Harley, and feel free to jump in if there's anything you wanna ask. But, so we've come in, and now our next person is Bianca here, who is our technician. And, you know, you've come from a clinic where they didn't practice fear-free, which again is where I started in my world of vet med too. And how do you feel it's changed you as a person?
Yeah, so definitely seeing my patients happy and comfortable here, you know, whether it's getting their first set of puppy vaccines, or we have some of our older patients who have maybe not had happier visits elsewhere. They come in, and to see them kind of transform into, you know, just their happiest selves while at a vet clinic is amazing to me, and it makes me happy to be part of it, definitely.
Yeah, I definitely, I love it when some of the pets will come out of the room and I'm going towards the back because we live in the back area, and the pets want to follow us.
Exactly.
And mom and dad are like, no, that's not your area, but I'm just like, they're comfortable here. They want to explore with us.
It makes it fun.
It makes it fun,
makes it
yeah.
fun.
Or the ones that come running towards the door and dad and moms are like, I don't understand why they're so happy to be here. And then we're busting out the cookie jars and stuff, and they're just like, and that's why you're here. Yeah, and it's funny because those that come back, I feel like it's a little kid where they're just like, I know where that treat jar is. I know where that treat jar is, you know, and they go immediately to that section. So that's pretty cool.
And I feel like it changes like the treatment, right? It changes it from just being like strictly medical, you know, we're trying to do something to more of like, it's an experience for both them and for me, just being able to.
I think that word
Yeah,
experience.
it's an experience, yeah. It's a happy one.
I like that you mentioned that we are improving not so positive experiences into better ones, and like kind of changing those into better ones.
Yeah.
I gotta say that's like one of my favorite things is seeing them kind of flourish a little bit, or kind of coming from being a little shy into kind of going from cowering and like right next to mom and dad to like, you know, coming out a little bit and maybe accepting cookies out of our hands. That's one of my favorite things. Even if it takes a couple visits, it makes me so happy.
That's one of the things too, and I know everybody's got a busy life, and you know, schedules can be filled with so many things, especially if you've got children or spouses or whatnot. You're running around, and so a lot of times it's everybody wants everything to go fast.
Yeah.
And that just builds it's excitement, anxiety, you know,
Yeah.
and it builds it up. And
Yeah.
so for clients that are definitely willing to work with us, and so that way this is not a scary experience.
Yeah.
I love it. I love people that do want to work with us and understand where we're coming from, because, you know, like the dog that came in and was petrified, and we spent some time, and by the end of the visit I was able to hug it, and it didn't get much, but I was able to hug it, give it some cookies, and they were coming back later on, you know, and it was nice.
Yeah.
Because it just makes me feel good of like, this is what we're supposed to have, that human animal bond with.
Yeah, because I mean, most of us who do join this profession, we do it because we truly love animals, and we want to see them happy, we want to see them healthy. So definitely to be able to see that transformation and be a part of it is it's a good feeling.
It
It's
is.
a good feeling.
But it's a deep breath. It's like you're allowed to take your time, because you don't have to do it. Like, hey, they look really anxious, so maybe it doesn't look like we may be able to do it today, but you know what, maybe let's practice going through the steps and try it out, see how they feel about it.
So I was gonna say, I'm just going to kind of squirrel, because you know me,
Yeah.
I do squirrel, but the same thing is my daughter who plays volleyball. I've always told her, like, when she's getting ready to serve, she gets that very high anxiety of like, am I gonna get it over the net? And I tell her, like, take a breath. And so as we're watching UF volleyball girls, you know, we see them take a breath. Well, now watching her, it's like she's, and she knows it. And it's like, you know, she knows that that breath just takes that moment to bring it all in. And sometimes you guys will see me right before I open the door, I like, you know, and it's amazing how it just kind of brings that, because you're going fast, you know, and so I love it. It's a breathing technique. I mean, yoga does it, Pilates does, you know, all these other things to calm yourself.
But that's what Fear Free feels like. I mean, we should be doing it, but to me, it just feels like a deep breath for the patient. Like they are allowed to not have to go through all of it if they're afraid. Maybe we just need to let them take a breath, not have to go through all of it right now, and we return and, you know.
Exactly.
So it's just nice.
We're giving them tools for a lifestyle and coping mechanisms, and we're able to, you know, allow them to take that deep breath.
Yeah.
So like it's okay to take a deep breath. You know, this is a new lifestyle for you guys. So, you know, but you're free.
Anyway,
So so Sammy, you know, you've been with us for a while, and you kind of fill in many shoes, but you also do a lot of the social media stuff. And how fun is it to get these fear-free things and start?
Okay, so there's a lot of things that I'm having a lot of fun doing that I like to do. One of my core things that I really love to do is just share experiences with clients, mostly because I would love for them to understand and see kind of from our point of view a little bit, but also kind of, again, give them the tools so that they can use them at home, because it doesn't mean that it only needs to be used here. They can use them at home as well. Like, for example, the pheromones, the music, they can use those tools at home. It doesn't necessarily mean that we need to just use it here. So one of the things that I love and would love to just get out on social media is the education aspect. You know, for example, what to do, what to expect, and I know a lot of stuff is just me recording you. I'm like, or how do you collect these things, or expect this or that, or, you know, get ready for hurricane season and you have these things ready. But it's just but it's just kind of like the client experience and kind of helping them, you know, be ready. So I just love people, and I love helping people with their pets.
So, and one of the big things is that, and you guys know, is that every Friday we meet up and we continue to learn, either sharing experiences or continue learning a new experience, or a new technique, a new trick, or something like that. We just continue to work with Fear Free, which is great. Some of the things, the advice that we can give to clients too is that, you know, especially when we get records early for those new clients, new patients, is, you know, we see some of them of caution, will bite, or muzzled or something. And so, you know, starting from the beginning of saying, hey, let's backtrack for a second. I know this may not be a successful visit, meaning like, don't plan to come in for vaccines only. Let's talk about the lifestyle so that doesn't happen again. We don't want to do that, and nobody should do that. I mean, I know my doctors too, they don't want to put me in a headlock to do something to me, but I have that fear and anxiety going to my doctors, you know, so you just, you know, kind of letting them know, like, happy visit. So, you know, if anybody's interested in what is a happy visit, you know, definitely call us, talk with Harley, and or we may answer too, but, you know, trying to get that, this is a second home. I mean, this is a second home to me. I hate to say it, but you guys are my family, so this is a second home to me too. You know, so this is our second home for some of these pets as well. And so I want communication is a big tool, education is a big tool, and just trying to get them to like us sometimes.
Absolutely. A welcoming environment for questions, for knowledge, for them coming in. So yeah,
Definitely.
Wonderful.
Do you have any other questions you guys want to share with anybody?
What has been one of your favorite cases, like your progressive cases?
Well, I guess I would say, I wouldn't specifically say one case in general, but I love it when a client comes in and says that they don't like to take their cat to the vet because their cat doesn't like being at the vet, and that their cat is not happy or whatnot. And I get into my little yoga positions and stuff, and I work with these cats, and I love it. You know, I just love knowing that, you know, not all cats, but, you know, some of them I get to make friends with, and I just love that. The dogs, you know, again, it breaks my heart when one of them doesn't really like me or is afraid of me because they know what I'm about to do, you know. So I like the fact that when they see me and they're little, like, I know there's a treat, I'm gonna get a treat and maybe a pet, you know. And so I like it when they actually feel comfortable sitting next to me. That to me alone is a victory of like, here, I don't need to look at you in the eye, I'm not going to look at you in the eye, but you're comfortable enough to sit beside me, and I love that, you know. And so I don't want us to get injured, and I mean, you guys all know that I broke a couple of ribs from a dog that was high anxiety and stress, and that was another driving force for me to be like, hey, we can't do this to ourselves too. And the animals too, where if they're frightened or, you know, they have that high anxiety, they've got two things that they're gonna do. They're either gonna fight or they're gonna flight. And that's the thing, is that so people are like, they're aggressive, and it's like, no, they're scared to
They're
death.
really scared.
You know, I'm like, you could say I'm aggressive at the doctor's office, but I'm scared to death of a needle coming at me.
But we can voice it.
Exactly.
We have our voices. We can
Right.
be our own advocate. Animals can't. They they have to depend either on us as
To read their body
to
language.
read their body
and-
language, or their owners, you know, saying like, hey, I think maybe this is not the right
Yeah.
thing. They depend on us.
So saying that, I know we've been trying to play a little game of like, where's your pet at, with when we give that little chart. And I was very proud of an owner, and if you know who you are, catch yourself in that. His dog had a moderate FAS, it was about a 3, and they came back for a recheck, and skin was looking great, so the next step was to do vaccines. But the dog had not had any, what we call it, pre-veterinary pharmaceuticals or anything like that, but the dog's FAS was still kind of high, and, you know, yawning, lip smacking and stuff, and he's just like, you know, I think she's still a little stressed out. And I said, you know, she is.
Yeah.
And so I explained what I was seeing, and he explained what he was seeing, and he's like, I think I just want to leave this visit as this was a good visit. And I said, I agree.
I love that.
I loved it. I was like, you're hired, you know? You know, it was just a very nice feeling of like, hey, you're on our side. You see her body language. I mean, she would get down, she would take our hot dogs, or those hot dogs that he brought, you know, and she'd jump on the couch, and she would, very curious, would get some pets in and then go back to her safe zone. But she was still not comfortable with completely going into her space. And Dad recognized that. And so I was just like over the moon, happy that not only were we able to help the dog, but we helped the dad too.
Yeah,
So,
that's wonderful.
so,
That,
yeah. So anyways, you guys have any other?
No, I guess.
So yes, the big news is we are Camden's first fear-free certified practice. Yay! These ladies have worked hard for this. I'm so proud of them, and we're looking forward to continue providing services for all